And tonight we are joined by Dr. Dale Bratzler. He is the Chief Coronavirus Officer at the University of Oklahoma and received his master's in public health from the school in 1996. Doctor, thank you for speaking with us tonight. I'd like to start with just your reaction to the continued rise in cases that we're seeing and deaths.
Yeah, absolutely. 250,000 deaths in the United States, a figure I don't think any of us expected when this all started in early February and March, when we first started seeing the big outbreak of cases in the United States. You know, right now, more than 66 Americans are dying every single hour from COVID-19. So this is, I thought your analogy of World War I and the Vietnam War, the number of deaths was quite appropriate because this is our generation's World War.
It is heartbreaking, and these are people's loved ones that we're losing, Doctor. Are you concerned about hospitals being prepared for the weeks and months we have ahead?
So I think we're in a real problem right now with our hospital capacity in the United States. When you look at the map of the current growth of new cases, the Midwest United States has seen just this dramatic increase in the number of cases and hospitalizations. So in our state alone, we've seen more than 13,000 new cases in the past 4 days. And because of that, I know there's going to be a big surge in hospitalizations. Our hospitals are already getting full. So I think many states are facing that same thing, a crisis of hospital beds, lack of ICU beds, and frankly, not enough nurses and doctors to take care of all the patients.
Well, and then they've been working so hard for so many months. Vaccine hesitancy is a real thing right now. What do you say to people who don't trust the vaccine and won't take it?
Well, you know, there are always going to be a few people that just simply will not take a vaccine. And I you know, quite honestly, I don't spend a lot of time trying to convince somebody that's just from the outset not going to take it. But I think if we want to get back to any sense of what we consider our old normal, if we want to get back to normalcy in the way that we live, the way that we shop, go out, do things, then the most appropriate way to get there is to vaccinate enough of our population to really slow the spread of this virus, to get to herd immunity. And that's going to take 50 or 60% of the population having some immunity at the minimum before we really see a slowing down of the spread.
Doctor, I know you work in the university setting, and really having all of our college kids return home for the holidays is on the minds of so many of us as we try to mitigate the virus. So what is your advice for families to safely welcome our college kids back home for the holidays?
Yeah, it's a great question. We've been spending a lot of time with our students trying to teach them what they need to do as they go home for the holidays. So one of the things we're encouraging them to do is to get tested before they go. If they're positive, please don't go home. We've taught them if you have symptoms, even if you think it may be a cold or the flu, please don't go around your family members. We've asked families as much as possible to try to limit the size of the gatherings. Don't bring in a lot of people from outside. And if you're going to get people together at all, please do things outdoors as much as possible. Try to physically separate, wear a mask. Just remember that 40 to 45% of the people who have this infection look fine, feel fine, and you don't know if they're infected or not. So you just have to make the assumption that anybody you encounter could have this infection.
And finally, Doctor, just a few seconds left. How worried are you about the emotional toll that this pandemic is having on so many?
Yeah, it's really had a substantial emotional toll. So one of the terms I don't like very well is social distancing. I think we need to remain physically distanced, but we need to be socially connected. We need to stay physically healthy. We need to take care of ourselves, get sleep, and stay informed, but not obsessed about what's going on right now.
Well, Dr. Dale Bratzler, Chief Coronavirus Officer at the University of Oklahoma, thank you for your time and for your advice tonight.
Yeah, it's my pleasure.